All right, hello, we are group 10A and we are going to be presenting on IPTS case number 3 today. So today we're going to discuss radical belonging and the importance in healthcare teams. We're going to be presenting a proposal to the Hope Commission to support radical belonging at M Health Fairview. So we're going to go through some recommendations. We're going to talk about the impact of COVID-19 on marginalized communities. We're going to walk through a few key implementation steps and discuss the financial ask or impact, as well as talking about the metrics of success and sustainability. So just to get us started, when talking about radical belonging, the definition that we came up with is that it's a guided vision that establishes anti-racist learning communities, and it is built upon emphasizing the social, academic, and democratic belonging for students of color. So every child of color deserves to feel that they belong as a full and equal member of their school community. And this definition comes in part from the definition of radical, and that it is a change to the fundamental nature of something. Also, it's important to think about seeking to transform schooling as a system by centering students of color in their full humanity. And this is a constant process that requires continual and reinvestment by each participant.
So just to summarize the definition, radical belonging encompasses all the aspects, including the social and academic aspects of feeling a sense of belonging in a system as a student of color. And the reason this is important is because if people feel that sense of belonging, it empowers them to speak up and share their thoughts. And this also allows for insightful conversations with multiple different perspectives, especially when you have people of different backgrounds. And particularly in a healthcare setting, it allows them to connect with their patients of color as well, allowing for better patient care. And this allows for a better cultural awareness in the team that can influence the team and the people in the team for the better.
The reason that we need this sort of cultural awareness support is because we need to be supporting these people who are from or represent these marginalized communities. Because as we've seen, this is not something, healthcare in general and health and sickness is not something that treats everyone equally. During COVID-19, for example, marginalized communities were far more affected by COVID than non-marginalized communities. 2020 data from this analysis by the Missouri Hospital Association from St. Louis, for example, examines COVID rates essentially by race and also stratified by zip code. What they found, as you can see on the bar chart on the left, is that marginalized populations, particularly marginalized zip codes with less than 5% of Black population, represented less of cases, whereas populations with 50% or more represented a majority of the cases in St. Louis of COVID-19. For example, some exact numbers here. If you look at zip codes with less than 5% Black population, there's only 127 cases per 100,000 people in April of 2020. Whereas if you look at these zip codes with 50% or more estimated Black population, there's 400 cases. So that's nearly a threefold increase. So therefore, this support of marginalized communities through radical belonging is very important.
So moving forward, in terms of some of those health disparities, it's important for any kind of healthcare program to take special consideration for the communities that are disproportionately impacted by chronic illness, including things like COVID-19 that more acutely have greatly impacted those communities, as we just talked about. So POC and individuals in lower socioeconomic brackets should be taken into greater consideration. Outreach should be made into these communities as a priority to make sure that they have access to healthcare services. And furthermore, the healthcare providers that work in these communities and see more should be given special wellness initiatives like access to therapy services, meditation, yoga, things like that, to continue to support them as they are dealing with these disproportionate amounts of sickness. So in terms of our short-term plan, a focus will be made on keeping employees' health and wellness at a high, keeping staff healthy and happy, preventing burnout, and preventing lower staffing levels. So we plan to increase health resources for the team, as discussed before, improve communication between higher up management and frontline employees, expand hospital administration staff to help keep up with the backflow of scheduled patients who may have had delayed healthcare due to some of the shortages caused by COVID-19, as well as a plan to increase trust among team members with different backgrounds in order to provide better healthcare for our patients. Moving forward to the long-term plan, an effort will be made to correct the health imbalance between the COVID exposed so that the marginalized community is not dealing with the greatest impact, preventing another pandemic response. So legislature at the state and national levels, as well as hospital-wide emergency protocols. So if something like this were to happen again, there is a plan in place. And then to move forward by cementing the short-term solutions and integrating them into the long-term goals, which include a long-term vaccine rollout and education for the general public, as well as investing in public health campaigns in order to make sure that the greater community is aware.
And then for our financial portion of this topic, we were thinking that with the risk or the impact, it shouldn't be too expensive because we can really do research pretty simply, because we can do anything that we can allocate the internet or any of those types of things of nature and just send them across the Wi-Fi and everything. So it shouldn't be too cost effective. And it's just like tools that we can measure the data, the things, aren't going to be very cost effective, and so like costs and how we're suggesting to be funded is mainly about like donations, because with this research, we can really change the way that the COVID really impact us. So we can really come back to as close to as a normal society as we were before the COVID pandemic happened. Since that happened, there's been growing cases of depression and everything. So if we can find out through these surveys and everything how that is affecting everyone, and we can like deal with this depression and everything, then it's more beneficial for our society as a whole. So funding shouldn't be that hard of a problem. We can do donations and everything, or just apply for grants and everything through the government, and it should probably go through just because it's so beneficial towards the society as a whole.
So in terms of our metrics of success, we thought one of the best things to do would be to hear from the patients or also the employees. So the best way to do this was to just add like surveys to assess the performance of the team and the patients as well. So we could get feedback and to measure how much they liked their care and how everything went for them, and to measure their satisfaction. And we can compare this data to previous years just to see what we need to improve on, and maybe we got worse and what we need to do better, and just how we're improving as a whole.
Our plan is applicable to a variety of healthcare settings and organizations. As stated, our plan is relatively inexpensive depending on funding, making it accessible to others. Also, as discussed previously, radical belonging and the health and wellness of a healthcare team is one of the most sustainable things an organization can do for itself. When employees are prioritized and feel like a team, there's less burnout and better communication. This is imperative in every healthcare setting. The final part of our plan regarding public health education in the times of COVID can be done on any scale. Whether it's campaigning at a legislative level or hanging up flyers in an office, this part of our plan can be done in a multitude of ways. Overall, our plan is sustainable and scalable for a variety of healthcare settings to implement.